In an incredibly open and honest interview, Bills offensive tackle Dion Dawkins talked about his battle with COVID and the fact that he was hospitalized for 4 days and for a period of time feared for his own survival.
There was moments that I was like, I don't know if I'm gonna make this. Like I was down bad.
And feeling like everything hit him at once.
If there's a checklist for it, it was everything. It was shortness of breath. It was the hot and cold. It was the cough. It was like everything.
Dion said he had gotten both shots, but was days away from being fully vaccinated. And as he laid in the hospital, he said he wished he had gotten the vaccine a little sooner.
I said, man, how am I a professional athlete and I'm down bad like this? I said, I can't imagine people who aren't healthy and don't work out and really don't do anything. I was like, man, just God bless them.
And physically, where is he now?
In practice, I'm like, whew, we just went through warm-ups and I'm kind of, can I get a water? But that's all a part of it. I took a hit and now it's just time for me to get back.
When asked about teammate Cole Beasley and his anti-vax stance, Dawkins supported his teammate, saying he doesn't believe Beasley's anti-vax. He thinks his teammate doesn't believe he got the proper amount of information. But Dawkins went on to stress everybody should get more information and make the right choice for themselves, like he did for himself and for his family.
The biggest vaccination drive in U.S. history is about to get even more extensive. The White House expected to advise most Americans to get COVID booster shots 8 months after being fully vaccinated.
We're seeing the breakthroughs, but also the pandemic is spiraling out of control again.
If the FDA okays it, these booster shots could start mid-September. Good afternoon. I'm Jenny Ryan. Doug is off. Until now, experts have said boosters weren't needed for the general population. But as Jane Chaco reports, the Delta variant changed all of that. Jane?
Jenny, doctors tell me the public will need the additional protection of a booster shot against COVID because the Delta variant is so much more contagious and the rising number of breakthrough cases among vaccinated people. However, they say there's no rush for those with normal immune systems. This week, Pfizer and BioNTech announced they submitted initial data to the FDA to support the use of a booster dose for their COVID-19 vaccine. Dr. Ann Falsey, an infectious disease expert at URMC, says a booster shot would help protect vaccinated people from severe illness.
Those folks could be walking around kind of spreading it and they don't even know it. And so if you vaccinate them with boosters, you're cutting down on some transmission.
Dr. Falsey says a booster shot would be given 8 months after someone becomes fully vaccinated. She says there's no reason to get it sooner.
I think that we can take a deep breath. This is not like January when you were completely unprotected and you're unvaccinated. People are still protected.
However, certain immunocompromised people can now get their third dose of the COVID vaccine. Data shows that many of these patients had weak responses to the initial doses.
Because we can't really rely on herd immunity because of the fact that enough people aren't vaccinated, this is really the one thing that transplant patients can do to protect themselves.
Laura Baker had a heart transplant in 2014. She says even after getting 2 vaccine doses, tests reveal her body isn't producing antibodies. She hopes the third shot she received on Saturday will help.
It's not a given that I'll develop antibodies, but it's an extra chance though.
13 WHAM meteorologist Scott Hesko, who was also immunocompromised, got his third dose today. He's hoping to be more protected from the coronavirus.
What I saw, and I've been watching, reading published studies, was that people like me, 485 greater chance of getting hospitalized or gravely ill from the virus. And I've worked too hard through this heart transplant recovery to put myself at risk like that.
And Dr. Falsey says data shows the side effects of a booster shot seem to be mild. They're similar to the side effects after getting a second vaccine dose. Jenny?
The return of school for most begins 3 weeks from today, and families are now getting their first glimpse of how it will look amid another COVID surge. Good evening. I'm Jenny Ryan. Doug is off. So far, there is no vaccine mandate, but there is one for masks in most schools. Masks are where the controversy lies for some parents who oppose their use in school. But as Tyler Brown found out tonight, the Victor superintendent told families masks are making it possible for the full return to school. Tyler?
Jenny, Ontario County leaders say wearing masks allows kids to be able to sit closer together, and it opens the door for extracurricular activities.
The reality is we can't stay open right now if we don't have universal masking.
The Victor school superintendent was quick to admit masking is one of the more controversial parts of the school reopening plan, but he told families they're not alone.
Every district that I'm aware of at this point is going to, at least in our area, going to universal masking at the beginning of the school year.
The Delta variant and community spread are big reasons why masks are being required. The COVID risk in Ontario County is now considered substantial, and masking, leaders say, enables schools to fully reopen by allowing students to sit closer together.
The transmission within schools has been very, very limited. And I think because of good hygiene practices, good mask wearing adherence.
A Victor school survey of 500 parents found overwhelming support for masks inside schools. But it isn't the only issue. Some parents want the district to offer a virtual learning option to every family. Victor, like many area districts, say it's only available to students with a medical issue.
If I were to go in person and I was to contract COVID and bring it home to my sister, who is vulnerable, I could just never forgive myself if she were to have a fatal case of it.
Monroe County Executive Adam Bellows says that county health leaders are meeting with districts weekly to go over their reopening plans. Onondaga County is going to do a vaccine mandate for their schools. So far, we have been told that in Monroe County and here in Ontario County, that is not the plan so far.